Hi, everyone. This is Ariela HaLevi, and welcome to Soul Stories. I love talking to people about soul stories and getting to know their thresholds. Like, where was a threshold in people's lives, and what did they do with that threshold? And how do we live through the soul's eyes instead of the body or the mind or whatever other people say about us? And so my guest today is the amazing Dr. Isabelle Amigues. And she is a rheumatologist based in Denver, Colorado. She honed her experience by studying in Paris as well at Columbia University in New York City. At age 40, she was diagnosed with stage 4 metastatic breast cancer. A timely meeting with a non-traditional trained practitioner taught her a different approach to disease, where she experienced the power of meditation, visualization, energy healing, and love, which I love that. Her journey through cancer inspired her to learn more about these alternative techniques, and she now blends Western medicine and Eastern techniques into her practice at UnabridgedMD. Welcome, Dr. Isabelle. It's so nice to have you.
Well, and thank you for having me. It's such a pleasure.
Thank you. I have been looking forward to this podcast for as long as we scheduled it, mostly because I've scoured your website, first of all, and I think that we align in so many different ways.
Mm-hmm.
And although it sounds like you've come from a very medical background, your experience with breast cancer has obviously changed your life in so many ways, but you started to explore this non-traditional side of medicine. So I guess let's dive in.
Yeah.
Could you tell us a little bit about that experience of what happened to you on that threshold of getting diagnosed, and how did you find the non-traditional way of healing as well?
So I'm going to start with saying that I've actually spent 17 years of training, and it's actually my shaman. I had a shaman.
Amazing.
And when I was thinking of leaving my institution, she was like, well, it's kind of a symbolic work of just light a candle per year of training. And I had never put it together. 17 years of training. It's a lot.
Wow.
Yeah,
okay. So you were already studying this before.
No. This is just to share, the amount of Western medicine that I've learned.
Oh, got it. Okay, got it.
So that's 17 years of training and counting, right? And so the breast cancer story actually is kind of almost like the end of something before, which is that I got diagnosed with this cancer 2 weeks after my 40th birthday.
Okay.
And a couple of months before of my 40th birthday, I went into a typical cliche almost midlife crisis where I was like, well, I'm not happy. This is not what I want. I'm not happy as a mom. I'm not happy as a spouse. I'm not happy in my practice of medicine. What have I done? Right? This looks on paper like everything that I've always wanted, but I was deeply, deeply unsatisfied, deeply sad. And so I started actually going deep into myself, talking to my friends in France, actually, and going, listening to meditation already. And I wasn't good at it. So I kind of was like, no, this is not for me. I'm not good at this. But really starting to just ask questions about, what I wanted in my life. And I was really trying to get out of this crisis and thinking that I was very cliche, because I was like, oh, look at that. This is cliche. I'm 40 and here I am. Crisis. I want to, exactly. I want a divorce and I'm 40. Hello. You cannot make more cliche than I am. Right. And so I was so worried with this midlife crisis. I didn't actually pay attention to, fevers that I had at night and sweating that I had at night and the fact that I was losing weight, and I was actually happy to lose weight because I wanted to climb better. So I didn't pay attention to some sign where you're like, that was actually probably the first sign.
Right.
And it's in the shower as I was crying and trying to be away, not trying, being away from my spouse and my kids. I was crying in the shower, and, I was looking at my tears down my chest, and I'm like, that's not supposed to be here. And basically like called my insurance, and not my insurance, but like my healthcare,
Provider.
people, and they were able to get me in like for a biopsy. Like, basically I called on a Saturday, they got me in on Tuesday, and I was going to France for 5 days right after. And it's funny, as a physician, I mean, of course I knew what it was, but I had all of the differential diagnosis of how it could not be it, right? So it's like, no, it's going to be sarcoidosis, it's going to be this, it's going to be that. And you're like, no, of course. And then I was in France when I had a final diagnosis, when they read everything, and it was not great. But the thing that was amazing about being in France is that I was surrounded by my family and by my friends, and since I was not happy in the life that I had, which was with my spouse and with my kids, I was actually surrounded by the people who really I felt truly loved by. It doesn't mean that I wasn't loved by my kids and my spouse then. It's just I didn't feel it. Right. I mean, how can you ask a 3-year-old to do that? But it is what it is, and it was very traumatic to have kids. So maybe that that's in it. But so when I got this diagnosis on the phone, and my spouse was like, but have fun. He didn't want to tell me. And I was like, look, we all know, like, you've got to tell me now. Right. And so he was telling me, and I think it was very painful and probably very traumatic for him to share this diagnosis of undifferentiated, highly undifferentiated, like all of the bad things, like not really hormone, not sensitive. And you're like, and in my head as a physician, I'm like, not good. And then there's this HER2 positive, 100% of the cell. And I'm like, okay, I don't remember what HER2 is, but that has to be good, right? That has to be good. And then my ex-husband is very, very smart and very knowledgeable as a physician. And he was like, yeah, I've read about it. I think it is kind of good. Yeah, I think this is good for you, right? And at the time, we knew that it was at least a stage 3. So it had already affected the lymph node. We didn't know that it had affected more than that. Wow. But I was in France. And the funny part is, it's a friend of mine that I got, like, almost as I hung up the phone, I was like super, like really teary, not feeling well. My family next door with a new baby in the arm. I was a new aunt. And I'm like, oh, okay, this is like, the circle of life. There's a new baby, I'm gonna die. And then I was like, okay, maybe not. Let's not think about that. Right. And my friend calls me and she's like, oh, Isabelle. And she was laughing. She's like, oh, of course it's you, Isabelle. You couldn't do just like a midlife crisis like anyone else, like just divorce, get a new car. No, you had to go for it. Like, and she started laughing, and I was like, wait, what? And it's you need friends like that. So, and I was like, wait, what? And I remember hearing myself say, well, I guess my midlife crisis is over. It was a short one. Now I'm going to deal with this. And she's like, yeah, and you're going to show us how it's done. Wow. And you're like, you have so much life energy. I have no doubt you're going to be fine, right? This is, and you know why, like we talk about the power of the mind, but I'm a physician and she's not. And another friend also talked to me and she's like, oh, you're Isabelle, you're fine, right? Wow. But it's the power of the mind of, yeah, I'm good. I'm okay. It's going to be okay. Right. So even when I heard about stage 4, and then I was like, okay, buddy, you have my attention now. Right. I wasn't in the mindset of I'm going to die. I was in the mindset of, yeah, this is my midlife crisis. I'm going to show how it's done. It's all good, right? Just because of one person telling this to me. Because instead of sharing her fears, she shared how she saw me, and she saw me in full vitality, beautiful. Right? Yeah, it is gorgeous, right? Like, and I can tell you, if I had not been in France, because of how sad I was in my current environment in Denver, I probably would not have had the same outcome. It doesn't mean that it's the fault of anyone. Right. It's just that I was surrounded with, you got this here, and laughter, and almost kind of like, shrug it off on the side, like it's fine. Right. Versus, And the whole reason I was coming to France was to do a party for my midlife crisis. Cause like, you know what?
Wow.
I'm having a midlife crisis. It's pretty sad. And I'm going to make it, I'm going to make it fun. Let's have a birthday party for me. And I'm going to embrace my midlife crisis. And then it was this party of Isabelle just got diagnosed with cancer, but it's totally fine. She's going to show us how it's done. And the practitioner that I met then, so I was there for 4 days at max, maybe like 3 days. And I crossed Lyon for like an afternoon. And I basically called, while in Paris, I called this practitioner who's a naturopath. I had never met a naturopath. I didn't believe in what they were doing. But I had seen my friend go through not a midlife crisis, but a crisis.
Right.
And she had shared some of the talking that she had done with her. So it wasn't for the naturopathic care per se. It was more for the talk therapy care that she had done. And so I was like, look, I just got diagnosed. Can you see me? I'm actually only in Lyon for like a couple of hours. Is there any chance you can see me? She opened a practice for me, saw me for a full hour. During that hour, I remember thinking, all right, this office is gorgeous. There's plants everywhere. There's light everywhere. This person clearly is loving.
Right.
And it's not about just like, let me see you make money and just go. No, she cares. Right. And we just talked. And at the end, she didn't offer me any sort of like herbal supplement or whatever. Like we talked. And it was incredible because I'm sharing my story. I'm telling her how I was dying before I was diagnosed with cancer, right? I was dying. I was not doing well. And here I was being like, okay, now I have a choice. I can die, or I can figure it out, right? But I had no judgment. Like if I die, it's not my fault, like right? And I didn't choose that, but I'm getting to choose. And she said something fascinating. She told me, don't see the cancer as an enemy, but see it as a friend that's here to teach you something. And like if any good friend is going to go when their time is the right one. And it carried me. And so suddenly I'm like, wait, I've been thinking of diseases as enemies. But actually,
like to fight cancer.
Yeah, exactly. There's no
fight.
reason to fight. Like,
right.
And so it changed, right? Like we were talking about the shift. That changed everything for me. Because suddenly I was living with this. It was my own DNA cells. Like those cells, those cancer cells, they were mine.
Right.
Now I say deux, right? Because I don't want it to be mine.
Right.
But it brought me a lot. I'm very grateful for the experience. And I mean, it is. The fun is great. I learned a lot. I don't need that. Right. But it's so interesting how we think, right? And to think, to think at times where I was scared. I mean, there's no way I wasn't scared. Of course I was scared, but I was scared, and at the same time, I had this feeling of this is here to help me. No matter what this is, it's here to help me. This is a friend. And so when you're walking, right? Like I'm walking, well, it's a friend. I'm not walking with an enemy. I'm walking with a friend. So that's actually, it is beautiful. And it didn't come from me. It came from her. And it's funny because I actually had a TEDx talk where I shared that. I was like, look, we keep fighting when really we should embrace and learn. What can we learn from our condition? Not disease, but condition, right? And that was the beginning of a huge journey. But again, the reason I was open to it was that I was in this midlife crisis before. And so I was trying to get out of this midlife crisis. And I was open to alternative stuff, right? And so this naturopath, I was like, yeah, sure, I'll do it. And what's interesting is that after I went on this journey of like, look, I want placebo on my side. Placebo is at least 30%.
Right.
How do I get placebo? I'm a physician. It's not ethical to give placebo in this country, in the US. I don't know if in France it's still placebo, but I learned how to give placebo as a physician in France.
Wow.
It's so good. It's so good.
With the patient knowing that they were receiving, or like
no,
mixing?
They did not know.
Okay.
So that's why you could say it's probably unethical. That was in France. I was a medical student, right?
That's fascinating.
But you know what's fascinating is that there has been studies that show that even if you say this is a placebo, it works.
Right. I mean, that is the power of the mind.
Mindset.
And it really
exactly.
It really is.
So it's so cool. And right. And so then you're like, all right, yeah, I'm going to do the medicine. Of course, I'm going to do the treatment. And it's super powerful. I love Western medicine.
Right.
And I'm not going to look at any studies because the studies are always outdated.
Totally.
So I don't want to learn about the survival rate in stage 4 cancer. Heck no.
Right.
I don't want to learn. Like, I'm Isabelle. I'm good. Like, I'm me. And I'm going to have the power of placebo on my side. So I did Reiki, I did Qigong, I did a bunch of things. I didn't continue with all of them, but I tried a lot.
Okay.
And there were 2 things that were really powerful for me. I mean, more than 2, but like 2 practitioners that were really powerful. A craniosacral therapist and a Qigong practitioner. And it really changed my life for the better. And what's funny is that I felt better during this whole cancer journey than I had felt before.
Wow.
And I'm not just saying before, like, you know, a couple of months or several months. No, I'm talking like before, like years before. Because suddenly I was paying attention to myself. I was meditating. I was visualizing. I was like figuring out, what do I want to do? What do I want to do with my life? If this life is over in a year, like, what do I want it to be looking like, right? So yeah, that was powerful and a huge shift in how I practice medicine, because suddenly it's like, hold on. Like, because I continue to practice medicine because I really love it. So I continue. And then later on, when I was in full remission, I actually started looking at the data of meditation, the data of visualization, the data on affirmation. I actually even started looking at data on energy, on shamanism and all this. And it's so cool. I mean, we can talk about it, but it's, and suddenly I'm like, wow, I was so scared. I was so scared of looking at this. And if I had known that I didn't need to be scared, I would have been okay, right? But, you know, I did what I could. I mean, it didn't change anything. I was just like, I don't want the placebo to go away.
Right.
And it didn't go away.
And, you know, speaking of energy, sometimes you have to be in, especially when you're going through something so serious, you have to be in your own energy. Totally. Right? You can, like you said, your friend said, oh, yeah, it's Dr. Isabelle. She'll be fine. You'll be fine. You'll be fine. You have to be in your own energy and not look at the stats so that you can really focus in on, what does my body need to heal and how am I going to do it? Exactly. And sometimes, you know, later you look at it, but now when you're in it, you just have to kind of be in a bubble almost.
Yeah. So it's funny that you're sharing, but so yes, I was very, and I still am actually, because it has changed me for the better, I think. Yeah. Man, yeah, for the better, for sure. It's almost like I discovered who I was. And I was driven by my ego a lot before. And suddenly I was like, no, I'm not an ego. I don't care about my name on a paper. Right. I don't care about that. Right. That's not what's important. What's important is the impact I have around me. And so I became much more clear on who I wanted around me. What's really interesting, though, is that because I was much more true to who I am, and I'm not going to put this in the past because it still happens, I have met incredible people since. And I've had like an incredible tight-knit friendships that have been created, not thanks to the cancer, that's not what it is, but thanks to who I became.
Your mindset.
I don't know that I want to say who I became, but who I truly was able to uncover. Yeah. Because I truly always was there. I think it's just, you know, the expectation of society, expectation of myself. And it's funny, like when I thought, oh, my mom thought, you know, wanted that for me. And then you're like talking. And then, no, she didn't want that for me. Right. Like, no, she did not. I thought. I constructed that, right? So, yeah. And, and then... that was really a beautiful journey, very scary in many ways, and very transformative and beautiful.
Well, first of all, thank you for sharing, right? I know that you're pretty open about your journey, it sounds like. And I love something that you said, because in Kabbalah, which is Jewish mysticism, and also in shamanic studies, we talk about this idea of uncovering and returning, right? And so when you're talking, what I see is like this jewel, and it was like in the ground and it had dirt on it and it was kind of covered up for maybe, I don't know how many years, right? But what you did with that threshold, that diagnosis was you went and you dug her up and you shined her off. And now what I hear you saying is that you're walking around with that beautiful jewel, like fully out, not underground and shining. Yeah. And that is who you really are.
Yeah, and I think
right?
we are all like this, and that's the
For
thing.
sure.
And it's funny it's always nice to hear someone share,
Yeah.
and I'm reflecting on your words.
Right.
And I was like, well, I still need to protect that jewel, right? And so, but I think what it is that it's intentional. It's like, I am the jewel. Everyone
Right.
gets to enjoy this.
Right.
But if you're going to hurt, I'm not there. Even
That's
if
exactly
I
right.
hear the fact that you may be hurt, so hurt people, right?
Right.
But I'm still there, but I'm not, like, my energy is mine. I'm
Absolutely.
not sharing my energy
Right. With just
just
everybody.
like that. Yeah, exactly.
Yeah.
And so I think, and maybe this is what happened, is that it was much more intentional. It's like, what do I truly want?
Yeah.
You know,
It's beautiful.
And who am I? Who am I? That was a big one.
Right.
Who am I?
Right.
Yeah.
I mean, also, it's like with that jewel, you're talking about really sacred boundaries. And it's so important to be in your full, I don't know, I call it feminine.
Yeah.
But like, to stand in your full feminine, it doesn't mean that we just hand the jewel off to like the guy on the street or the coffee, the barista next door. It's like you hone in on that jewel, you discover it, you grow it, you do practices around it. And then you say to the world, this is my beautiful jewel.
Yeah.
If you're lucky, you can come in here and see how beautiful it is. But not everybody gets to be inside of here.
Yeah.
I mean, I think that's also part of growing up, right?
Yeah.
We go through hard things and then we recognize, wow, I either can drag myself through the mud here through life and be miserable, or I can take care of myself in a way that maybe I never have. And then your life changes.
Yeah.
And for you, it sounds like, coupled with traditional medicine, that just changed your whole life.
It did. And what's beautiful is that I think it changed also the life of many patients in the process. So I've changed. I mean, it's not me. This experience has changed the lives of many of my patients in the process, because it suddenly, I do think that I was always very open to I'm going to call it, I used to call it placebo. Now I call it mind, body, or, energy. And some people, will call it like God, or, if they're Catholic, or, whatever. Like, I'm just thinking of a couple of patients, but it's the same to me.
Right.
It's this belief that you are supported by something bigger than you.
Exactly.
And somehow I think that love is part of this, right?
Yeah.
When you love, you can change so much things, right? Like, you can change so much. And as a physician, if you love your patients, you can change so much. And I don't think we share this. Yeah. We never, maybe because we want to protect ourselves, but it's like, it doesn't mean that you don't get to share.
Right.
That you're going to be like, okay, hide your love. Like, you love a patient, share it with them.
Right.
Maybe that's the only love they may have right now at this moment, right? So it's a beautiful, it really is beautiful. I think life is beautiful, and people are beautiful, and we are so much more interconnected than we think we are.
Oh, I agree. I agree. There's so many ways I want to go with this, but one thing I want to touch on is something that you said when you were first diagnosed. Your friends, you called your certain friends, you were in France, and they said, of course you have this. Of course you've got this. And like that really is the power of words.
Oh my,
right? It is mindset, which is what you say to yourself, and then who you surround yourself with. And I love the idea of somebody who sees patients, right? I see clients, you see patients, and somebody who is in that healing profession to say, yes, this is what the papers say, the labs say, the blood work says, but this is what I believe, and this is what I see about you, and this is who I see in front of me. And just that, like you said, I think that is love. To say to a patient, you're more than just like, when I get lab work done, I have serious anxiety, right? And it's so much anxiety. I have to say that to myself.
Yes.
Before I open that lab result, I'll sit myself down and say, that is not who you are right there, whether it's positive or negative. So I just think the power of words are incredibly important. Mostly what we say to ourselves, right? What we say to ourselves is the external of who we attract and who comes into our lives. Totally. But I think that is love.
Yeah.
It starts in that inside.
Yeah, no, absolutely. It's funny because I'm so with you with the power of the words, and I don't think physicians get it. Maybe because it's, they have like 5 minutes to see a patient,
right?
But honestly, like the power of our words, and the so I think the most powerful words are mom, like the power of a mom, the words of a mom. I really do truly believe that.
I love that so much.
Which
how many children do you have?
I just have twins. I mean, it's a lot.
That's a lot.
But it's not, I'm just thinking of me as a daughter, the really, and it can be a maternal figure. It doesn't have to be like a biological mom, but those words, they have so much power because they are the words that we've heard since we're a kid.
Right.
And I've tried it with my kids, and they'll have like a little code. I'm like, you're going to sleep and tomorrow you'll be fine.
Right.
And they are fine.
Right.
Yeah. And then there's no study. I cannot do a study. Yes. But basically, it's like we hear it. Like as a mom, Right. But what's funny is like you have also moms are very anxious and are constructing, like, they are reflecting on their own fears in their kids. And then you're like, and again, I'm talking, it could be a mom that's like 70 and their kids are 50, right? Right. Because those words have a ton of power. So I sometimes tell patients who come with their mom, I tell the mom, I'm like, your job is to say every day you're doing a little bit better than yesterday. You're keeping doing better and better. Totally. Because that's total power. The second are people in possession of, quote unquote
power.
And it's not power, but knowledge, right?
Yeah.
So educators, but physicians as well. And, I'm assuming in religions also, like priests and, those have power too. Absolutely. And so if it's funny, my mom took me to a church, and she had me like, have a little prayer by a priest to go. I think it was to have babies actually. And I was like, yeah, whatever. But like, my mom believes in this. It's okay. I can believe. Like, why not? I'll believe in that too, right? Yeah. Beliefs. And then the doctor. And we can use that for our patient or against our patients. And I think we have to use it for our patients. That's and some of my colleagues would be like, but isn't that unethical? And I'm like, how is it unethical to give hope? Right. How is it that if I say to a patient, you're going to do better, you're going to take this drug, you're going to tolerate it super well, and you're going to go in full remission. I believe in that. Right. And if it doesn't work, that's okay. We'll have our treatment. It's not a big deal, right? Like it's not like, but imagine I'm giving a treatment and I was like, I'm not sure it's going to work. So, and that's what some doctors do. Right. They're like, we can try this. And they're like, but in 20% of the case, it does work. Right. What? Right. Like what?
But that is so ingrained, I think, in our society. My mom passed away 7 years ago, and she was dying of cancer. Right. And I've sat in the doctor's office with her, the last appointment she had, and he said, we've done everything for you, and now you have to go home and die.
Oh my God. Yeah. Sorry, I should not say that.
And I sat there, and it was like this, you could just see all the hope was gone. And then she died shortly after.
But that's the thing. And that
I never forgot that. Yes.
Yeah. It's like, okay, so I had a friend, so a very good friend of mine, his sister had the same type of cancer than mine. And so she had started maybe like 3 years prior mine. And she had an oncologist that went and got retired. So a year after, I was in remission already at that time, thank goodness, because I think it would have really like pushed me. And I remember, so she developed metastasis to the brain. And there was a treatment that just came out, New England Journal of Medicine, incredible treatment, where basically like 60% of the patients were doing really well, and they had failed already 7 previous lines. So we're talking about exactly her. She was the perfect patient for that study. Here it is. She has brain metastasis, but that's okay because she has this, right? And she got a new doctor. And that doctor said, I'm so sorry. There's not much we can do for you. And I said, go and have a second opinion. She goes to the second opinion and they tell her, yeah, you can. We can try. We can try the other thing. She developed side effects from it. Yeah. That's okay. That happens, right? Again, if she had had any of the, the persons that the doctors that are believing, they would have been like, don't worry, that happens. We have other ones. It doesn't mean anything. It just means like we have to be a little bit more careful with your liver. Fine. The liver regenerates, by the way, right? But that's not what she heard. And what happened, and it's so fascinating. I don't think my friend will listen to this, so I can actually share this. My friend told me that when he heard that she had had liver metastasis, he had basically given her a bye-bye in his head. So imagine like when she's seeing her brother looking at her, is constantly basically looking at her as if she's dying. So then she died. Basically that doctor was like, well, 3 months and you're dead, right? So she exactly died then. And I remember I was like, the words killed her. It's not the cancer that killed her. It's the words that killed her. I'm not saying if she had wanted to go, that's totally fine. Like sometimes you're like, hey, you know what? I'm done. Bye. Deuce. Like, it's okay. But I think having those words, removing the hope of someone, what's the goal? So, except the fact that the doctor was tired, didn't want to have to deal with it, felt that this was a little bit difficult for him and didn't want to have to deal with it. So, you know what? Just go and see palliative care. And I remember like when he told me this, my friend, so the brother, about the liver metastasis, I was like, Patrice, you know that I also had liver metastasis? And he looked at me, he said, no, I did not realize that. I was like, yeah, it doesn't mean anything in this cancer. Or maybe it does mean, but the data is not great. Plus the data is backwards because we have all those new data that are coming. So it's fascinating. To me, it's like, you're going to a doctor and the doctor, because they are tired, because they are burnt out, they don't realize that their main job is to give hope. And I mean, to me, I would consider that I fail if my patients are getting out of my meetings without hope. Hope that they've got me, like, I'm here, or hope that we've got a treatment. And we have so many treatments. It's 2025, almost 26.
It's amazing.
We have like an amazing amount of treatment for absolutely almost everything. Of course, there's always things where there's no treatment, but it's very, very rare in this time, in this,
that
age.
Is true.
Almost everything has a treatment. And the thing is, the more you're staying, the more you have chances of discovering a treatment while you're dealing with, okay, fine, I'm going to push through until there's a treatment. So
incredible.
It's the power of the words is huge. And I'm really sorry you had to experience that with your mom. And in those cases, you're like, you know what? La, 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 we are getting out of here. Bye, bye, bye. Like, this doctor is useless. Look at all those bad reviews.
Yeah, it was really hard. It was a really hard thing. It was really hard. But I think we're talking about the power of words and how that can
both
shape. Yes, like it positively and negatively. As a shamanic energy healer, I deal with a lot of ancestral things that are rooted in the DNA, beliefs, traditions, positive and negative, things that have been there for a long time. Like your mom had this and your daughter has this, and things that are passed down physically, emotionally, spiritually, energetically. And this is like one of my passions. It's partly why I had you on here. The power of blending Western medicine, because I truly believe it's essential, with the idea of, I consider myself energetically a researcher. When I go deep into somebody's field and think about, like, look at their patterns. Like, I think I was a doctor in a past life. Look at their patterns and their history of what they're exploring and what they're going through. And did their parents go through the same? And where did they come from? Were they in the Holocaust? Where did their ancestors come from? And did they suffer? Most suffered in war and famine and all the things that I'm sure all of our ancestors have gone through something similar, struggle, survival. And then to think about those behaviors and those beliefs that are just passed down until somebody says, okay, we're going to change this. How does that come into medicine? Does it play into medicine?
I do think it does, actually. But it's you have to have the time. You have to have the time and to be open to it, right? So because I experienced this, I so I remember when I had a fight between my left brain and my right brain. My right brain was like, I'm experiencing this. My left brain was like, this is BS. And I was like, yeah, but I'm experiencing it.
Right.
So, but I had I had a headache. I tried to learn energy healing. So I was like, this is incredible. I want to offer this.
Yeah.
And I couldn't because my left brain was constantly having this fight with my right brain. And so I would get out of those days of learning and I was like having the horrible headache. And at one point I was like, I'm so freaking done. Like this is not helpful. And it's actually learning. Actually, I didn't learn, but I read a book called What is Real by Adam Becker. And it's about the history of quantum physics. So it's not about, I'm not learning quantum physics,
right?
But I was learning the history of quantum physics and how we all came to, understand the Schrodinger's cat and all this. And I remember like this light bulb moment of realizing like the Schrodinger equation that can tell you, okay, the cat can be in all of the different options, right? It can be alive, it can be dead, but it can also be sick. It can have it can be there or there,
Right.
But the moment there's an observer, all the other options are gone, right? And then I was like, but that's it. That is it. I don't understand quantum physics. I'm not going to lie and I'm not going to say that I understand it. I don't understand it.
Right.
I do not understand it. But what I can actually kind of like grasp is this idea that the observer has all the power, right? Because you're removing all of the other options by observing one option.
Right.
Right. And so this is what allowed me to accept the fact that there was probably science behind what you're sharing, the ancestors and all this, right? Because my mind is always trying to put a reason to it. Right. I'm a doctor.
Right.
I learn how things function.
Yeah.
How does RA functions, right? Like how do you develop RA? How you develop lupus and all that. Right. So first there's a genetic component, but there's also an environment component. There's also a epigenetic component.
Right.
And so, it's interesting because I think you cannot take a person away from their context.
Right.
Right?
Yeah.
And so it's the same thing. You cannot take a disease, a condition away from what it's coming with. Right? It's a host and what they're dealing with.
Right.
And if we had the time, and this is why I opened the practice that I opened, is that then we can go deeper. Right. And I'm not a shaman. I think that it's fascinating. Definitely in another life, and maybe later on in my life, I learned that when my left brain gives me a little bit of peace. But it's, to me, I'm fascinated by that because it's like, hold on. There has to be, like, first of all, in medicine, we don't understand everything. Right. We don't even understand the power of placebo. And it's 30%, right? 30% of the people will cure their cancer if you give them sugar. Without telling them there's sugar, of course. But, and then they'll die if they know that they had placebo. If you tell them, oh, actually, whatever you got doesn't work. Right. If you actually tell them, well, actually, it does work, it's placebo, they might actually do better, which is so fascinating. But yeah, the power of the mind is, and I'm saying the power of the mind, I don't know, like, is there more to it, right? So to come back to your question, I do think you have to blend it all. Because again, if you're telling a patient like you've got this, you're actually telling them you've got this. It's not me, the doctor, that's got this. Like, I can look at them and be like, I can help you. I understand what this is, and we've got treatment for you. But it's you that has got this. Right. And so I think that's energetically by itself, it's huge, right? For sure. But yeah, I hope I'm answering your question. I got super excited about it.
No, it did. I think the combination of Western traditional medicine, where we treat the body, the physical, the cells, combined with, a lot of people, when they get cancer or an illness, they go to therapy. Yeah. Right. And I think therapy is amazing and it helps. And I think to take it a step farther and going into, what are the beliefs that you've carried that are creating, like you said, you were not in a good place. You were not that gave you cancer. Yeah, exactly. I would never say that.
It's different. Yeah, exactly.
But there were things that in your life that needed changing.
Yeah.
Right. And so to look at the whole person, I think is so important. I think that's kind of what you're saying. And it sounds like what your practice is.
That's exactly it.
Like, to give love to a patient is seeing the whole person. And when I see clients, I see them as, the physical, energetic, emotional, and spiritual part of that makes up
Yeah.
all of you.
Absolutely.
I think that's the amazing part of energy healing,
Yeah.
right? Is that we have the ability to heal on all these levels. It doesn't always happen that we can heal physically, but it's incredible to work on all those pieces.
I'm going to share something that's really cool. So rheumatoid arthritis is a very inflammatory disease, right? So it can destroy the joint. It can cause inflammation of the vessel. It can actually cause lung inflammation and lung disease, heart disease. It can be pretty bad.
Yeah.
And we have incredible treatments. We have like biologics and all this, right? Well, it turns out they did like a study where they stimulate the parasympathetic system by stimulating the vagus nerve. So they put around the vagus nerve, they put a stimulator, and then basically I think it's like 2 minutes in the morning, 2 minutes at night, you have like a stimulation of that parasympathetic system, the vagus nerve. It works for rheumatoid arthritis.
Wow.
And so the way that I'm thinking about this is, you have a condition, but one, are you ready to get rid of it? And to like, is the friend, have you learned enough that you can let go of the friend? That's number one. Second is what can you learn? Like, I want my patients to have learned something from their condition, and they don't have to share it with me, right?
Right.
But I think, the more I'm in this practice, and how, I love the medicine that we have in 2025, 2026, right? It's incredible.
Yeah.
But also realizing that we have those drugs that work super well. And so then we have beliefs that it's going to work. But that belief by itself, that decreases our sympathetic nervous system, right? So then you're more likely to have no side effect from those.
Right.
You're more likely to do them, and you're more likely to actually heal just because you're not as stressed.
Right.
Right.
So
and you're like, oh, I've got this. I'm fine.
Right.
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 Stage 4, who cares?
Right.
It's 2020 at the time. I can't remember, 2019, right? So I was like, 2019. Like, it's fine. Not a big deal. I mean, it was a big deal, but it was like, I got this, right? Like, I got this.
Right.
And also, I have no control. So I'm going to do my best.
It's amazing.
And I think that that's what it is. It's like, I mean, the energy work fascinates me because it's the science of it that fascinates me, actually, really, right? It's, I think, I don't know if you're aware of those studies that are looking at the frequency around people, and it changes, and you're like, wait, what?
It's incredible.
Yeah, it is so cool. And it would be so cool to have a study that looks at the frequency before and after shamanic work. I don't know.
Right.
Because that would be super cool.
That would be really interesting.
Exactly.
I mean, I think it's like, if you change your frequency, you can change your health.
I do think so. And again, I'm going to put it in my words as a physician. I'm going to put it like, well, you're decreasing your inflammatory cytokines because you have activated your vagus nerve, right? So I'm trying to give a reason. The good news about the good news is that most of my patients don't need to have a reason.
Right.
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 And people who come to you, they don't necessarily understand how it works. They are just feeling it. Right.
Exactly.
And that's what's fascinating. Like that
Their
to
lives
me, it's
improve.
like so cool. Right. Yeah. And at the same time, you're like, I'm trying to give this thing, worse for worse, like, at least it's resetting your sympathetic system.
Yes,
and that is good.
Totally.
Right?
Yeah.
You don't need to have a device that you're taking a surgery to get there.
Right.
Maybe we can do that from outside.
Yeah. I think to kind of conclude, I would love to just first tell you a little bit of like an inside kind of thing inside of me. And then I want to ask you a question from it.
Of course.
So I've struggled with mold and autoimmune issues and gut issues and being a strep throat carrier for most of my life. And for a lot of my life, my feeling was my body comes before my soul because my body is hurting. And I have to do what I have to do to heal my body. So it was like this very intense determination because when I want something, I go get it. And so for a lot of years, it was like, I am determined to heal my body. And what I realized, and I think this comes into your healing, what I realized was that I had to put something greater than myself before my body. and then work with my body from that place. So to me, that's the soul, that's God, that's spirit, whatever you want to, energy, whatever you want to call it. So now in your life, you've been healed miraculously and doing the work of healing from cancer. You're seeing these amazing patients. Your life has changed. How do you live personally from a place of energy or soul?
Yeah, it's funny because it's actually very interesting. It's almost like it empowered me to a place actually that I would almost argue that it felt like the power was within me.
Yeah.
And so it doesn't come from outside.
Yes.
It's not a higher power that's from outside, but rather
Within.
I am the power.
Yeah.
And that's what's so empowering. And that's what I'm trying to get to my patients, where it doesn't come from outside. It's not like, oh, why me?
Right.
But rather
it's very
like,
empowering.
Yeah. And so when you say a higher power, no, it's not a higher power because it's my power. And it's within me. And it's almost like it has this feeling of being infinite, right?
Yes, absolutely.
So yeah, it's something like this. I don't know how to describe it better than that.
Well, I like what you said, because it's the idea that the energy within you is very powerful.
Yeah.
And that doesn't come just from your cells and this like physical skin and the organs. It comes from something greater, and it lives within you and it breathes within you. And so it sounds to me like you used that empowered feeling, that healing, to move past and heal
but
from
I don't
cancer.
know that greater is the word. You know what I mean? Like it's not a greater, but it's not a finite. So maybe that's what you mean. Like it's not finite.
Right. It's like ever.
It's
like flowing.
Yeah. That's what's tricky about energy. It's really hard to talk about that.
It is.
Yeah.
Well, I just wanted to thank you.
Thank
This
you.
went by so fast. I could go on and on.
Yeah.
I love the idea of what you're doing in all of your practices around the Colorado area. How can people find you and get connected with you?
So my practice is called UnabridgedMD, so that we see and I am the non-edited version of ourselves. So UnabridgedMD, I have like social media on UnabridgedMD. I also have a podcast and a YouTube video, YouTube channel, UnabridgedMD, or Dr. Isabelle Amigues, Rheumatology 101. And then, we are seeing patients from Colorado, either virtually or in person in Boulder or Denver. So,
amazing.
And it's still open. And I just created a group coaching where all of this, actually I'm bringing all of this with teaching so that we have science behind all of the things that we're doing, so that we're empowered to do it all. And so if anyone is interested in that group coaching, I love it so much. Yeah.
Amazing. Amazing. Thank you so much.
You
Dr.
bet. My
Isabelle.
pleasure.